Hi, I'm Nandini Oomman, Senior Program Associate and Director of the HIV/AIDS Monitor at the Center for Global Development. My job at the center, along with a team of top-class researchers in Uganda, Mozambique, and Zambia, is to better understand how HIV/AIDS donors like PEPFAR, the Global Fund, and the World Bank can improve the effectiveness of the massive amounts of funding that they provide to reduce deaths due to AIDS and prevent HIV/AIDS infections in Africa and other regions of the world. Well, why are we interested in this? If you think about it, in 10 years ago, less than $500 million was available to address the epidemic and respond to the epidemic. In 2007, we see that we had a total of about $10 billion. So we are interested in understanding how donors with all of these resources are setting policies, programs that respond or follow from those policies, and how they can manage these programs so that they deliver results, but also learn from the issues and processes that are not working so that they can in fact increase and improve the next time around. I first became interested in the issue of financing, donor financing for HIV/AIDS in the early 90s when I was working in the heart of the red light area in Mumbai, one of India's largest cities, in an HIV/AIDS prevention program for sex workers. One day, the project that I was working with was tasked with the job of hosting a visiting US congressman who was doing a reconnaissance trip in India and other Asian countries to assess the magnitude of the epidemic. Well, as I was walking this very friendly US delegation through the teeming brothels, I couldn't help wonder why and how a US congressman would be able to mobilize US taxpayer money to fight the epidemic in what seemed to be concentrated at that time in the poorest of the poor world, i.e. sex workers. Well, 18 years later and $18+ billion later, I have the unique position at the Center for Global Development to actually lead the research that can answer and ask some of these hard questions about how money is being used to achieve these goals. So what are some of the questions that we're asking? We're interested in how the money flows from the donor to the recipient country, and how the money then is allocated, who's receiving it, what are they able to do with the money, what can they actually spend on the money, is the money very restricted, how quickly does the money flow. We're also interested in understanding, for example, how donors are making decisions about the next payment. Are they making these decisions based on performance and or other criteria, or is it just as the project is completed that money flows? So we're really interested in understanding that. Most recently, our attention has focused on how AIDS financed programs from donors are actually interacting with the health systems. And we've looked specifically at components of the health system, the health information system, the supply chain for ARVs and essential drugs, and the whole issue of the health worker shortage in countries in Africa, to try and understand better how HIV/AIDS donors with all of their financing can maximize the opportunities to strengthen the capacity of the government and the private sector to actually deliver a broad range of health services, high quality health services, in addition to achieving, of course, their goals in their HIV/AIDS programs. We are going to share these results with the donor heads in Mexico City in an exciting event where we will actually be in discussion with the donor heads to try and understand how these recommendations can be acted on moving forward. So you can see that the HIV/AIDS Monitor is interested not only in strengthening the evidence base around donor financing for HIV/AIDS, but equally interested in making sure that this information reaches the right audiences. So in a systematic way, we are producing the evidence and using that evidence to inspire change in the donor programs, but also to stimulate an informed conversation between donors, recipients, and other stakeholders. to ultimately achieve what we really want to do, which is to reduce deaths due to AIDS and to prevent HIV infections. So I've come a long way, in 18 years to better understand how donors can actually provide money from the rich world to the poor world. And my research is helping me understand many of these questions. And I hope that it will also answer questions that others have exactly about this issue.